The Premier is warning the state's COVID numbers could get worse before they get better. There are 18 new cases of local transmission, and most of them were in the community while they were infectious. Gladys Berejiklian says she's bracing for the numbers to go considerably higher this week. At just one school in the eastern suburbs, hundreds of students are now considered close contacts.
Unlike most of us, Kate Mulhern and her family can only leave the house for one reason.
The adults we're retesting on the 2nd of July and on the 7th of July, and the isolation ends on the 9th of July at midnight.
Provided they return 3 negative tests. For 7-year-old Finbar and 5-year-old Eamon, holidays began on Friday. But so did 2 weeks of isolation after a student at their school in Sydney's East tested positive for coronavirus.
Liam just called to me across the other side of the house holding his phone up. Have you seen it? I was like, what?
Around 500 students attend South Coogee Public. 4 are now positive. That number is expected to grow.
All students are now close contacts and must get tested and self-isolate for 14 days regardless of a negative test.
There are 18 new cases, 17 are linked. The source of one is unknown, but had been in the Bondi area. Of these cases, 12 were in the community, while infectious.
We have to be prepared for the numbers to bounce around, and we also have to be prepared for the numbers to go up considerably.
To avoid that from happening, the Health Minister wants people to get vaccinated even while in lockdown. Revealing of the 30 people who attended a house party, 24 have now tested positive. The only ones who didn't were the remaining 6 guests, who all happen to be health workers, and all of them are vaccinated.
For those who still out there think that vaccinations aren't important, they can find excuses not to have vaccinations. They can kid themselves not to have vaccinations. Short message is, get vaccinated.
Easier said than done, according to Kate Mulhern, who as a teacher isn't eligible.
Especially considering how contagious this new strand is, I think that the government really needs to rethink whether or not teachers are considered frontline workers in this.
While most are doing the right thing and staying home, others are bearing all to break the rules.
Unbelievably, we saw 2 men sunbaking naked on a beach.
Their relaxing getaway was interrupted by a deer. The men were chased into the Royal National Park and got lost.
Not only did they require assistance from SES and police to rescue them, they also both received a ticket for $1,000.
While the 2 nudists were sent home, Kate Mulhern and her family are hoping to leave in 11 days. Mark Reddy, ABC News.
And Mark Reddy is live for us tonight in Surrey Hills. Mark, the supermarket chains are cracking down on panic buying.
They sure are, Juanita. Anyone who is buying toilet paper at Coles and Woolworths will now be limited to buying 2 packets per day in response to the panic buying. Here in New South Wales, there are no other restrictions on meat or groceries, so the advice to customers is to shop responsibly.
And the list of exposure sites too just keeps growing.
Yeah, that's right. So initially it was concentrated around the eastern suburbs and inner city, but it continues to grow out west and in the south, meaning no area in Sydney is immune. Anyone who attended Domino's Pizza at Marylands, the Glen Quarry Hotel in Macquarie Fields, and Black and Gold Espresso at Rosebery is now considered a close contact. So you need to get tested and immediately isolate for 14 days regardless of the result. The ABC also understands a student at Rose Bay Secondary College has now tested positive for coronavirus. Possibly more than 1,000 students are now self-isolating. Bellevue Hill Kids Club is also an area of concern. There is some good news though. New South Wales Health has now cancelled a public health warning for the food court at the T2 domestic terminal for last Thursday. Anyone with questions or concerns should visit the New South Wales Health website directly. Juanita?
Mark Reddy reporting there. Other states and territories are battling their own unfolding outbreaks, with one reacting despite recording no cases. Greater Darwin's lockdown has been extended after the detection of 7 cases linked to a worker at a Central Australian gold mine. At least 900 fly-in, fly-out workers have left the mine in recent days. They've been told to isolate. One of Queensland's new cases is a miner who worked there. As a result, several restrictions will come into place for the southeast from tomorrow.
This mask wearing will be in force for 2 weeks. 2 weeks in those regions. But of course, if we see any further spread of this in other parts of the state, the mask mandate will come into other parts of the state as well.
In Western Australia, a woman has tested positive for the virus after coming into contact with a returned traveller from Sydney. Mandatory mask wearing and caps on gatherings are in place for the Perth and Peel regions for at least 3 days. And South Australia will introduce new restrictions for 1 week from midnight. That's despite recording no new cases. Also today, the Premier came out swinging about the pace of the vaccine rollout. Ahead of today's National Cabinet, Gladys Berejiklian vented her frustration about a lack of planning by the federal government. Here's state political reporter Ashley Raper.
There are very few reasons to leave your home right now, but this is definitely one. And the view from the vaccine line reflects the view of the Premier.
No hesitancy if people want to get the vaccine.
Gladys Berejiklian insists demand currently exceeds supply. And while more doses have been promised, she's concerned there won't be enough places for people to get them.
You have to plan for the future. You have to plan for the weeks and months ahead. And I'm getting frustrated that people aren't doing that at other levels.
A swipe at the federal government, which oversees the vaccine program for GP clinics.
At the moment, we don't have enough GPs signed up. And that has to happen across the nation. That has to happen across the nation.
The Premier also wants GPs to be able to administer not only AstraZeneca, but Pfizer too. This anger over the federal government's vaccine rollout from the Premier isn't new, but it's certainly heightened because of the situation New South Wales finds itself in. Gladys Berejiklian was clear this outbreak would have been different if more people had been vaccinated. And she says she'll continue to argue for more vaccines for New South Wales based on the intake of international arrivals.
We've had other states, because of their situation, not be able to do their fair share. We will continue to do that. But I think it demonstrates the burden that New South Wales has been carrying.
As a result of the current outbreaks, Queensland wants to limit the numbers of Australians returning from overseas.
I think our caps need to be lowered for overseas arrivals.
It's a view not supported by the New South Wales Premier. Ashley Raper, ABC News, Sydney.
The reality of the lockdown is also being felt in the state's regional areas. Many towns have been banking on strong school holiday trade, including communities still recovering from the March floods.
The tables at this restaurant west of Port Macquarie would normally be full during school holidays.
There we are. $4,500 alone from Sydney this week were coming to do safaris, quad bike tours, 3 or 4 day stays, relax, bushwalking, all sorts of things, all had to cancel.
Adding to the impacts of COVID-19, the nearby Oxley Highway has been closed for more than 3 months due to significant damage from flooding, hurting businesses reliant on those travelling by road.
If people stop, they then go into your little shops they buy in the homewares, the clothing shops and all of those places. So in a way it affects every business, but it also affects the farms. You know, this is our link to abattoirs, it's our link to sale yards, feed coming up from the coast.
The restrictions for local businesses in other towns are also tough to swallow.
We need every dollar we can get, and the last thing we need is this to go further to a shutdown. And I think that's my biggest fear, because it doesn't just hurt the economy around, local economy of the towns, but it's also your staff.
It hasn't been gloom for all businesses though. Some local attractions continue to draw in fans of all ages, including those who were already on the road before the lockdown, as well as locals.
Some of them may have already been out of the area, some of them coming from other parts of regional New South Wales, but so far, fingers crossed, we're about where we would expect to be for a school holiday.
Every good day will be crucial as the threat of COVID lingers. Karen Thomas, ABC News.
National Cabinet is meeting this evening to discuss the deteriorating coronavirus situation across the country. Political reporter Matthew Doran is live for us at Parliament House in Canberra. Matthew, what are the leaders aiming to agree on?
Juanita, good evening. Top of the agenda will be the issue of mandatory vaccinations for aged care workers. This is something that National Cabinet agreed to at its last meeting, but they kicked the issue off to health authorities to try to figure out how to put it into practice. We understand that advice will be presented this evening and leaders are expected to agree to it. There had been some concerns about forcing aged care workers to get the shot and that some workers might quit in protest, but the situation is considered so serious now with the Delta variant appearing across the country that the trigger for mandatory vaccinations of aged care workers needs to be pulled now.
And a lot of questions, of course, are being asked about the quarantine system. Are we going to see any changes announced?
Well, this is two different elements to what we're expecting to see from the National Cabinet tonight. The first situation is that of domestic travellers who are in hotel quarantine being put in the same facilities as international travellers. There has been this quarantine leak in Queensland which has raised those concerns, and we're expecting leaders to agree to a blanket rule that those two classes of travellers do need to be kept in separate facilities. The second issue is the vaccination and testing of quarantine workers after the Sydney outbreak was linked to that driver taking aircrew from the airport to their accommodation, getting infected and not having been vaccinated. I do want to stress, though, that we're not expecting that to be a mandatory ruling. It would just be a strengthening of those requirements. Exactly what that looks like remains to be seen, but also the definition of who is eligible under those quarantine worker definitions will be extended to include those indirectly attached to quarantine. So the workers of people working in the system there. Many people would be wondering why we're only dealing with these issues now. All the states and territories can pull some levers to try to close these sort of loopholes along the way, but it often does require National Cabinet to come together and the Commonwealth to intervene to ensure there is that consistency right across the country. Juanita?
Matthew Doran updating us there on National Cabinet meeting, which is happening this evening.